After you develop diabetes, for the first few years, there are no telltale signs or symptoms that you can notice. So diabetes often goes undetected until the damage to your eyes, kidneys, nerves and heart becomes more permanent. On the other hand, testing your blood sugar regularly in anticipation of developing diabetes someday into the future is a costly and time-consuming proposition. So what is the option? And who should get screened for diabetes regularly? I'll answer that question in this video. I'll also tell you how you can find out yourself if you should get tested. A diabetes risk score helps in knowing your risk of developing diabetes. Such scoring involves answering a few simple questions about your life and lifestyle. If the score is above a certain level, one should get tested more often. In this video, we'll use a risk score developed for Indians, though it should be applicable for many ethnicities, especially the Asian community. The diabetes risk score is calculated based on your age, waist circumference, physical activity, and family history of diabetes. So let's start. I'll enter my own values and you do the same alongside. Your age. Select one of these three choices and note the scores. My age is about 50 years and so I'll get 30 points. Your waist circumference. There are different choices for men and women. Since my waist size is 92 centimeters or 36 inches, I get 10 points and my total so far is 40 points. Your physical activity. Here you have three choices. Now be honest and select the right one. It doesn't matter how active you were in your college days or 2 years ago. You want to know your risk right now, and so select your current activity level. I regularly exercise even in these COVID times, so I get 20 points here and my score now is 60. Finally, do you have family history of diabetes? Did either or both of your parents had diabetes? Of course, your parents need not have diabetes. It could be a sibling or a parent of theirs too. My father had diabetes, and while my mother does not have diabetes, her siblings have diabetes, so I get 20 points for that. Thus, my total score is 80. What is your diabetes risk score? Now for the interpretation. A score of less than 30 is low risk. Congratulations if you have that score. 30 to 50 is medium risk, and above 50 is high risk for developing diabetes. So everyone who is not yet a diabetic but has the risk score of 50 or above should get blood glucose test done looking for diabetes at least once every 12 months. And sadly, that includes me. Interestingly, I just got my blood sugar reports a few hours back, and my average blood sugar, or something called HbA1c, is 4.2. So I'm happy I'm safe as of now, but I'll get tested again in 12 months. Obviously, you cannot choose your age or family history, but your activity level and waist circumference are modifiable. So if and when you change the latter two, your risk will change. Similarly, a few years later, if your age category changes, your risk will increase. And for your information, the average score for normal people is 48, for pre-diabetics it is 57, and for diabetics it is 61. You can see more such diabetes related videos here. Remember, ignorance is a bad idea when it comes to preventing diabetes. Thank you.